My name is Khattri Chettri. I am the service line administrator for Goshen Heart and Vascular Services at Goshen Hospital in Goshen, Indiana. I am trained as a family nurse practitioner, and I have been with Goshen Hospital for the last 16 years. Um, and today I'm here to talk about the effects of COVID-19 disease and its implications for cardiovascular diseases. When we talk about cardiovascular diseases pre-COVID, we oftentimes talked about modifiable risk factors and non-modifiable risk factors, such as age, genetics, and family history. And then we used to talk about, our smoking habits, our cholesterol, blood sugar, high blood pressure, uh, drug and alcohol use, the body mass index. We talked about our ability to exercise and how often we exercised. And so these were the things that we used to talk about. And we looked at disease prevention as our first effort to make sure that we were staying healthy, eating well, getting plenty of rest, low stress, keeping our stress levels at a low levels, getting plenty of sleep, making sure our blood pressure, blood glucose, cholesterol levels, and our habits like drinking, smoking, even prescription medications, obviously illegal and illicit drugs. We discourage those to reduce our risk. And then came early 2020, and this global pandemic hit us in a way that we did not foresee coming. And as time went on, we realized that this was a very serious and very rapidly evolving and rapidly spreading disease that was affecting people's lungs, and it was affecting people's hearts as a result. And given that heart and vascular medicine is one that is very well studied and researched over the course of history, and we were getting early studies from China, mostly in Asia, because they were the first ones to see this happen. And we were finding out that people who had cardiovascular diseases had a much higher risk of getting complications when they got infected with the virus. And so their risk of going downhill was higher, their risk of hospitalization was higher, and their risk of dying from COVID-19 disease was higher than folks that did not have cardiovascular diseases or risk factors. So to the extent that folks that had high blood pressure, people who had obesity, people who were who had lung conditions, heart failure, atrial fibrillation, we were finding early on that these folks were at a much higher risk of getting complications. And the early studies indicated that people were developing different kinds of these, what we call cardiomyopathies, as an effect of the COVID-19 virus, and as a result, it would affect their heart function in a way that it wouldn't work very well, and would really affect the patient negatively in a rapid way. And even if people survived the COVID-19 disease and were discharged from the hospital, they had long-lasting effects of the COVID-19 virus, because the structural changes that happens in the heart muscles because of these different cardiomyocarditis was a lingering effect, and it would affect the functioning of the heart. So that was something that we discovered early on. There were a lot of discussions about how some of the medications that we were using, whether we should use certain kinds of blood pressure medications, such as ACE inhibitors and angiotensin receptor blocker (ARB) medicines, And those early concerns were put to rest when we discovered that it didn't have any adverse effect on the patient. So there was no harm in taking those medicines. So these were early things that we discovered during COVID for patients who were unfortunate to get the COVID-19 disease, get hospitalized, and have complications. The risk for patients who are diagnosed with cardiovascular disease, whether it is coronary artery disease, whether it is valvular disease, whether it's arrhythmias or any structural heart disease, it will always be of concern for patients. And so the studies from last year was that, if patients with cardiovascular diseases had a fourfold risk of getting complications from the seasonal flu, that risk of complication was double that when they were infected with COVID-19. And so if you or your loved one suffers from cardiovascular disease, it is very important that we take maximum precautions to protect ourselves from first getting exposed to the virus, and then second getting sick from it, and being able to manage it where the person doesn't have to get hospitalized for advanced care. And one of the ways to do that is obviously follow the Center for Disease Control guidelines on how to stay safe at home, and in particular in public settings. And so the tried and true methods of hand washing, hand hygiene, taking 20 seconds to wash your hands, both even down to the finger beds and in between the fingers, and both front and back, taking your time to wash hands, and then making sure that in between hand washing, making sure you are using hand sanitizers with 70% or more alcohol content in it to keep it protective. Other things would be to always wear a mask when you leave your house. There are some recommendations about double masking in public settings or in close spaces where you're likely to encounter more people, so that you have better protection and seal against that. Now, the mask is not a cure against the virus. It is a protection against the virus. It's a barrier so that when you breathe in and breathe out, and you may be asymptomatic, that you're not spreading that to other people, but also when other people are talking and walking and coughing, that the air that they breathe, it's less likely to penetrate the barrier that you're wearing around your nose and mouth. And it has to be covering nose and mouth and with a good seal for it to have better protection. So beyond that, those kinds of efforts and making sure we're socially distanced from one another, the biggest game changer right now is the vaccines that we have in place. So whether it is the Pfizer vaccine or the Moderna vaccine or the Johnson & Johnson vaccine, Johnson & Johnson being a single shot vaccine, whereas the other two being a two-shot vaccine separated by 3 to 4 weeks, these vaccines are highly effective. If we think about a miracle drug in 2021, it would not be the medicines that we use in cardiovascular medicine. It's the vaccine that protects us from this COVID-19 disease. And as we have found in the early months, so since it rolled out in the middle of December through now end of March, the folks that were most vulnerable to get this disease, and most of them have cardiovascular disease. We're talking about people over the age of 80, 85, 75, are the population that are likely to have cardiovascular diseases. And those folks who were early on eligible to get vaccines, what we have seen is that as their vaccination rate has gone up, their infection rate, their hospitalization rate, and their mortality rate has plummeted in the last 3 months. Whereas the age groups such as 18 to 49, folks that are just becoming more eligible to get the vaccine and are more likely to not follow the CDC guidelines. We have seen that those folks, their infection rate, their hospitalization rate, and their death rate in the absence of these vaccinations have skyrocketed in the same period. So the direct correlation of the effects of the vaccine in reducing the risk of disease, hospitalization, and death is profound and undeniable at this point. And the sooner we can have more people with or without cardiovascular disease, with or without cardiovascular risk factors, the more people get vaccinated, the better we are going to be to returning to near normal activities, to be able to spend time with our loved ones, to be able to travel without great concern. So that's the current state. Is the miracle drug right now is the vaccine, and it will protect our cardiovascular patients more than ever before. If we've seen any, it's the risk of infection, the risk of hospitalization, and risk of death from COVID-19 for patients with cardiovascular diseases. So the protection against the disease for folks with cardiovascular disease with vaccination, with any of the vaccines that are currently available to us, is a remarkable sign of progress and a remarkable tool for hope for our patients that we take care of. We all know, we as Americans, we like to travel, we like to party, we like to have a good time with ourselves, with our loved ones, with our friends, with our families. And so what COVID has done to us is that it has taken away many of the small and simple joys that we enjoy, which is to be out and about, to be free, to enjoy our wonderful spaces and enjoyment that we have. And what this has done is, it has all pushed us into secluded spaces, which obviously we are not accustomed to doing because we like to travel, we like to be out and about, we like to have a good time. And so we all understand, all of us, none of us want to go around wearing a mask. None of us want to wear eye shields. None of us want to be not able to shake hands with our friends, not be able to give hugs and kisses to our loved ones. So these are very, very profoundly sad times when it comes to our social relationships and social interactions and our social network. But at the same time, the virus doesn't care whether I have heart disease or not, whether how much I love my family or my friends. The virus does not discriminate against what my political beliefs are or what my religious beliefs are. The virus is an opportunistic bug, and it finds a vulnerable host, and then it infects us and basically takes over our immune system and makes us sick. And so in order to protect our most vulnerable folks, we have to take all the precautions that we can to protect ourselves, number one, protect our loved ones, and even the strangers that we don't know, so that we can have our community and our lives back sooner than later. But even during these difficult times, it is very important for us to make sure that we do what we must: take good care of ourselves, eating well, getting plenty of rest, not using tobacco products since this virus likes to attack the lungs, making sure that we are getting adequate physical exercise on a day-to-day basis. And if you have a treadmill, I'll give you an example of my 91-year-old grandmother, whom I bought her a new pair of shoes this past winter, and she literally mapped out the contours of her home, and she would walk from one corner of the house to the other corner of the house, go downstairs to her basement, and come back up, and she would tell me, "Ram, that was 500 steps." and that's what she did all winter. And now that the spring has come up, she's going and walking outside. And outdoor walking, not a lot of people in parks and in the neighborhoods. So you pick a time when you feel good, and you go out, go for a walk. Listen to your music, just taking the fresh air, listen to the birds, and go for a walk. If you like riding bicycles, find a trail of and just go for a short bike ride and do that. So it's important to do those things. But again, one of the things that this pandemic has done is Zoom meetings. So yes, we can't see each other and we can't hug each other, but at the same time, you can certainly FaceTime with each other. You can Zoom with each other. There are free apps there. Making sure that you're making connections, you're making sure that you're doing things that bring you joy. And so just because COVID has taken away certain aspects of our freedom and our networks, find other ways that are available to reconnect with ourselves, with our health, and with our loved ones, so that when we can get all vaccinated, then we can return to having those friends and family together. And as you know, CDC has said if you're around a group of people that are fully vaccinated, you can actually give each other hugs, and you don't have to wear masks around each other. And so that's one way to getting back to normal. And so my recommendation to everybody is, follow what the American Heart Association and the American College of Cardiology recommends for everybody to do those Life Simple 7 recommendations, which is, to not smoke cigarettes, watch your sugar, watch your cholesterol, watch your blood pressure, watch your weight, be active, eat nutritious meals, and there are ways to reduce stress, to stay physically active. If we do those things, we can do those by ourselves, and until we can get back together with other friends and family. Those are things I would strongly recommend everybody to do. It's not easy to do, but these are things we can and we must do to stay healthy.